Respected audience, this is Naushab A. Khan, attorney at law, adjunct professor at law. In this series of programs relating to medical negligence, we are discussing different facets of this topic. And today I'd like to talk about types of medical negligence, and we will cover civil negligence as well as criminal negligence. So let's talk about the civil negligence first. In order to bring some act of healthcare service provider or healthcare establishment within the mischief of negligence, one needs to ascertain that what are the duties a doctor owes towards the patient. As a matter of fact, in legal terms, doctors have an obligation of means towards their patient, not an obligation of result. This is very important to understand. Obligation of means, that they should adopt all possible means to give the best healthcare services to the patient. As long as results are concerned, doctors are having no obligation towards the results, because that is that is an area that, being human, a doctor has no control of the results. So the in legal parlance, this is absolutely categorized that doctor's responsibility is only to the extent of taking measures and taking adequate means to provide the best possible health care. On the other hand, as long as obligation of results are concerned, he owes no obligation as far as results are concerned. This means that they have to take appropriate steps available to make the right diagnosis, provide treatment, and follow up on their patient's progress. Furthermore, this is one facet of this discussion, and that relates to the duties which are mandatory. On the other hand, and this also relate to the actions a doctor is required or a doctor is required to take. On the other hand, if doctor omits to take certain measures, we call it dereliction of duty. Dereliction of duty means that person willfully or negligently failed to perform his or her duties or perform them in an inefficient manner. This is within the purview of dereliction of duty. Now we will further discuss the second aspect, and that is the medical negligence and especially the civil negligence. Civil negligence can entail a consequence, and that is imposition of penalty upon healthcare service provider or healthcare establishment. Civil negligence, that is, compensation needs to be given to the patient or the patient's family if it is an ethical violation. License to practice will be removed. Complaints are lodged before Healthcare Commission or Pakistan Medical and Dental Council. So there are two primary aspects of civil negligence. If there is a civil negligence, a doctor or healthcare service provider and healthcare establishment, they are duty bound to pay the compensation to the patient or his or her legal heirs. On the other hand, if the violation relates to some unethical act, or there is a violation of ethical code which in fact regulates the functions and duties of doctors, then of course that doctor can end up having his license to practice confiscated, or he can be barred from practicing medicine or other areas of medical dispensation. So as a matter of fact, this needs to be borne in mind that first of all, doctor owes certain responsibilities to his patient. Number two, his inaction to perform certain duties falls within the ambit of dereliction of duty, and that dereliction of duty or non-performance of a duty can result into the composition or mischief of medical negligence, which can finally entail the consequences of payment of compensation or losing one's license to practice. With these words, looking forward to see you in part 4 of this topic, and in the next topic we will discuss at length the criminal negligence. Till then, take very good care of yourself. Goodbye.